Hey guys, this is Dr. Hub. Today we'll look at the types of type 2 antibody mediated hypersensitivity. So to begin with, there are three mechanisms. The first one is that there is antibody mediated cellular dysfunction. The antibody mediated cellular dysfunction. This has antibodies. They react with the antigens. So antibodies, they react with the antigens, and which are present in the cell surface. So they are present in the cell surface or on the extracellular matrix or on extracellular matrix, and they cause diseases by destroying these cells. Cause diseases by destroying these cells, and it triggers inflammation. Then it also interferes with normal functions, and it interferes with normal functioning. So what are the examples? So examples can include, there is myasthenia gravis. So this is against the acetylcholine receptor. Then comes, there is presence of the Graves' disease. So Graves' disease is nothing but it is against the TSH receptor. Next is the pemphigus vulgaris. So this is against the epidermal cadherin. Then comes the pernicious anemia. There is pernicious anemia. So this will be against the intrinsic factor. Then comes the insulin resistant diabetes. So this is nothing but against the insulin receptors. Then we have the antibody mediated. Opsonization. So antibody mediated opsonization as well as the phagocytosis. So they include the antibodies. Antibodies may deposit, and this is in the tissues or the blood vessels, and elicit an acute inflammatory reaction, and they give rise to an acute inflammatory reaction, and this is by activating. So it activating the complement. It activates the complement and the recruiting phagocytes. So the antibody mediated opsonization and phagocytosis. The antibodies, they may deposit in tissues and blood vessels and elicit an acute inflammatory reaction by activating the complement and recruiting the phagocytes. So the examples can include the transfusion reactions, then the erythroblastoma vitalis, autoimmune hemolytic anemia, then comes the autoimmune thrombocytic purpura. So then comes the third variety, that is a complement, and the FC receptor mediated inflammation. So this includes the antibodies. The antibodies may deposit in the tissue or the blood vessels, and it elicits an acute inflammatory reaction. So this is by activating the complement. So it activates the complement. So the examples here is that there is Goodpasture syndrome, then comes the vasculitis, and this is due to the ANCA. Next is the acute rheumatic fever, as well as a vascular rejection. This is in the organ graft.